Hello friends, in this video I will be talking about four things. First is Medicare, then next is PBS, that is Pharmaceutical Benefit Scheme in Australia. Then I'll be talking about bulk billing and then differences between public hospital and private hospitals in Australia. So starting with Medicare, Medicare is nothing but healthcare system in Australia. Like if you've got PR visa or you're Australian citizen, then you will get a Medicare card, and with the help of that card you can avail different healthcare services free of cost. So let us see what are the services that are covered under Medicare. General practitioners, then specialists fees are covered, then blood tests, certain blood tests, most of the blood tests, important blood tests are covered. Then government hospital treatments are also covered under Medicare. Like if you are admitted into government hospital, then all the treatments that will be done will be free. Then all emergencies are included under Medicare. In certain states, ambulance is also covered under Medicare. Like you can just call up ambulance, and then it will come to your house, and then that will be all free. In Queensland that is free, but in other states it may be chargeable. And there are a lot of other benefits apart from this that Medicare provides. You can find out on their website. But there are certain things that are not provided by the Medicare. For example, certain dental treatments, optical treatments, hearing aids, acupuncture, cosmetic surgery, and there are lots of other things that are not covered. So you can check, like on go to the Medicare website and see like if certain benefits are not covered or covered. If you know the MBS item, that is Medicare Benefit Schedule item. For example, if you go to JP, that item is called as 23, like a general consultation. And you can also search by that item number in that website and then see if that is covered under Medicare. It also tells like how much benefit you will be getting in terms of dollars. For example, if you go to GP and then do the general consultation, you will get $37 through government's Medicare system. And just like Medicare, there is another scheme called as PBS, that is Pharmaceutical Benefit Scheme. So you might get some benefits as well. So you can go to this website pbs.gov.au, and then over there you can search for the drugs or medicines, whatever you are taking, injections, and then find out if you are supposed to get any benefit. Now, very important thing, what is bulk billing in Australia? So bulk billing means there are some medical centers or doctors who will do bulk billing for you. That means if you get a treatment or services from them, you will not be charged at all. Like if you visit a GP who is doing bulk billing, they will not charge you anything. You can just walk in, take a treatment, and then go home without paying a single penny. So the reason why some people will do bulk billing and some doctors will not do bulk billing is that doctors who are like new, doctors who have just started practicing, they will offer this bulk billing because they want to gain the popularity. It is up to the doctors like how much they want to charge. Some general practitioners, some GPs will charge you $55, while some will charge you $35, while some will charge you $70. So it is up to them how much they want to charge. But if the doctor is doing bulk billing, that means he will charge minimum amount, and then you will not have to make any out-of-pocket payments. So if you want to go to GP, then don't forget to check out if they are providing the bulk billing services or not. If they are not providing bulk billing services, then that means you will have to make the gap payments or the out-of-pocket payments. Then what's the difference between public and private hospitals? So obvious difference is that in public hospitals, like out-of-pocket payments will be very less. Most of the treatments will be free of cost. But in private hospital, there will be some specialist fees, and there are some hospital fees that you will have to pay out of pocket. Like Medicare is not going to cover all those things. Another thing is that in public hospital there is a waiting period. There is a huge crowd over there in the public hospital. Like you will not get the treatment immediately unless there is an emergency. So that is another difference between public hospital and private hospital. And one more benefit is that of going to the private hospital is that you can choose which doctor can treat you. Like in public hospital you can't choose, like any doctor can come and then do the treatment. So these are main differences between public hospital and private hospital, and that's why a lot of people go for private health insurance, and then private health insurance will cover the treatments that are done at the private hospitals. So that's it in this video. If you have more questions about Medicare, then PBS, bulk billing, public hospital, private hospitals in Australia, let me know through the comments. Thanks for watching this video.